Welcome, everybody. We have a very, very special call this evening. And as most of you know, mangosteen has been dubbed a superfruit. And it is the only truly superfruit. And with us tonight is Dr. Frederic Templeman MD, who has been in private practice for over 25 years, who has become the world's leading researcher on mangosteen. And tonight he's going to share with us some of the most compelling, newest research on our beloved mangosteen. So I'm going to turn it over to you, Dr. Templeman.
Well, thank you very much, Sandy. It's lovely to be here with you. And Sandy, can you hit that next slide, because I'm still just seeing the first slide with an image behind it. I'm not seeing the second slide. No. Try again. Okay, now it's taking the time to come up. It's up. That's just my slide. Throw up the next slide, if you would, please. And I'm just going to talk as we go along as the next slide comes up. Ladies and gentlemen, it's been about 12 years now since I have been looking at the mangosteen for its medicinal characteristics and its things that I could use with my patients. As a standard practicing family doctor, years ago I was rudely shaken by the fact that I almost killed somebody with a drug. I certainly hope, and I don't know, that I've ever killed anyone. I imagine some doctors may never know. But in that particular case, when I almost killed this young man, I was very, very shaken, and I began to look for things that I could use to help my patients who came in complaining of a variety of complaints that would be different than drugs and not have the downside of drugs, which comes from the fact that every drug is potentially lethal. In certain circumstances, for example, a recent study indicated that about 12 very commonly prescribed adult medications are deadly to a child under 2 in one single dose. And I did have a case in my practice early on where a little 2-year-old was crawling around a hotel room when the family was on vacation, picked up a single pill that had dropped out of someone's medical box earlier on, and ended up almost dying. They were able to get her to a hospital, and the poison control experts identified what had happened and were able to save her. But drugs potentially can do a great deal of harm. I'm not suggesting that they aren't something that doctors should use, but I am suggesting that patients take greater control over their own health, and that they begin, now that information is available on the internet in lay terms, in such detail, I'm suggesting that patients take greater control for their health care and see their physicians more as consultants to them, rather than people who are going to dictate to them, who have knowledge that is inaccessible to the patient and can make decisions regarding drugs without the patient's input. So drugs are dangerous. I wanted to find something else that wasn't quite as dangerous, became aware, although I had known about them, but became more hyper-aware, I guess, of the advantages that supplements have over drugs in so many different situations. And I said, after using the mangosteen preparation, because for the first few months that I used it with my patients, it really didn't have a name. The one I was using was the Zango preparation, and it didn't have a name at that time. I just called it jungle juice, and I was using it with permission from my patients in those patients who would rather have tried a drug plus a natural product, or a natural product that may have had effect in place of a drug in something that wasn't a life-threatening situation. And after having looked at that for a couple of years, having watched my patients respond, I wrote something that is quoted on the screen. I said, I believe that the mangosteen will become the most valuable supplement ever, surpassing even the popularity of aloe vera. Now, that was 10 years ago. And today, I haven't changed my mind. It's been a decade since I said that. I am satisfied that the evidence is accumulating, which will mean that I was right back in 2004. and that as the mangosteen is examined not only by patients who may be using it as a supplement, but also by doctors and researchers who are looking at the plant for the ingredients that are in it, I think that it is going to surpass the popularity of aloe vera and certainly have an effect in the medical world that aloe vera has never had. Now, there's another slide coming up. I hope you can see it, but I can't see the whole thing yet. It's gradually coming. But what it's going to say is that the mangosteen is truly the only superfruit. Now, way back in 2004, the same year that I said that, my partner, who is a professor at a medical school, and I were looking at the contents, the biochemical contents, phytochemicals, if you wish, the kinds of chemicals that plants had elaborated over millennia, and specifically the mangosteen had elaborated to protect itself against microbes, so it protect itself against funguses, against bacteria, against viruses, protect itself against cancer-like growths, protect itself against excessive radiation from the sun, protect itself against the damage that can be caused by oxygen, because for plants, oxygen is an absolute poison. And we looked at these different categories that are there. Now, I've listed some on here, the phytosterols and the fiber. They aren't the most prominent ones. But when you look at the xanthones, this is a class of phytochemical that is stimulating so much interest by scientists in the mangosteen. We're going to take a look at that specifically, that one category, after we finish this slide. But these are somewhat overlapping categories. If we had a biochemist out there, they may argue with me that proanthocyanins are a little bit like anthocyanins, etc. These categories do overlap, but the mangosteen is the only supplement that I'm aware of that has at least 5 of these major families. Catechins, for example, are more common in the mangosteen than they are in green tea, which is where they are reputed to exist. They have great value for the human body when the body is trying to find the raw materials to be able to do what it wants to do. And the polysaccharides are there as well. And when you look at something like the aloe vera, for example, you have principally polysaccharides, really nothing else in great quantitation within the fruit or within the plant that is going to be of enormous value to the body. And so Dr. Morton coined this term, superfruit, and it was very quickly picked up by the commercial media, and they began to call everything superfruit. So we had the acai berry, which was a superfruit. We had the wolfberry, which was a superfruit. We had the noni fruit, which was a superfruit. We had all kinds of things that were coming onto the market and using this term superfruit, attributing it to themselves as if they were similar to the mangosteen, which they certainly weren't, because they don't have all of these categories of very important phytonutrients that the body can use when disease and problems with health are the major concern. Now, let's go to the next slide, because as we go forward and talk about the xanthones principally, we're going to be talking about the evidence that exists and that has come to light principally since 1980, because I'm going to be referring this evening to a very good article produced by a very reputable and well-known American university recently. As they looked at the mangosteen fruit and its xanthones, they came to some conclusions. They were actually not really trying to put forward a point of view, but they were looking in a review way, looking retrospectively at what had happened in terms of scientific papers about the mangosteen since 1980, and that's what we're going to be looking at. But when you look at the sources of medically relevant information / evidence, and I don't say evidence purely, because when you talk about traditional medical experience, and I've listed these in the order that I consider to be of importance. Now, certainly my academic colleagues are not going to agree with me that traditional medical experience has greater impact on proving safety and efficacy when you're looking at some active ingredient, whether it's a supplement or whether it's a drug. But for me, and specifically for supplements, what has gone on for millennia truly is the best measure of utilization of something that people are going to get benefit from medically. Because people just don't keep using for centuries something that is either dangerous and harms them, or secondly, that doesn't work and really isn't of benefit. Those things go by the wayside when they are tried, and when there isn't a positive experience or a positive outcome, they don't continue to use them. And so for me, the millennia of traditional medical stories, the references in ancient texts, these all have great importance, and I consider that to be about the soundest source for medically relevant evidence when you're talking about supplements and you want to see, one, is there a reason to believe that I should try this? The second thing, of course, is modern research, clinical research, or what would be called human trials. And these are terribly, terribly expensive. And because they're so expensive, in the supplement industry, which certainly does not have the profit margins that the pharmacological industry has, you do not find this kind of clinical research, at least not to the same degree that you would if you were looking at drugs or products, which can be protected, and there can be a predictable revenue coming back to the researchers who may have researched this and then produced it. And thirdly, there's what is very common in the supplement industry, somewhat disparaged by academics, I must say, but it's anecdotal experience. It is someone saying, I used this, and this is what happened to me. Now, that's very important medical evidence. It certainly is valid because it's a first-person report. It may have some bias, and it may not be as exact as something coming out of a randomized controlled double-blind trial in clinical research. Nonetheless, it probably is the type of evidence quantitatively that doctors and clinicians use more than they use of anything else that is more objective. And so when someone says, I had these problems, and I tried this supplement, and this is the outcome, that again is very relevant evidence for the choice of whether you're going to spend your money on a supplement. Now, in the final category, we have what's called preclinical laboratory research. And this is what composes, this category of evidence is what composes the vast majority of studies that are published in research papers, in medical journals, and in journals for a number of different medically related disciplines. So preclinical laboratory research, and there are two types of it. The first one is called in vitro. And this is important for you to understand as I talk to you tonight, because we're going to be looking at some in vitro research. And I want you to understand the value that it has. I don't want you to conclude that it's the best kind of evidence that exists, because that wouldn't be true. But nonetheless, it has great value. And it is the most quantitatively, the most common research that we have for the kinds of products that we're going to be looking at, and specifically in this case, the mangosteen. So the in vitro or bench research is when they might take a human disease, a piece of tissue, for example, from a cancer, and they would put it in a culture in a petri dish where the nutrients that are required for the cancer to grow are present, and the environment is controlled to such a degree that the cancer grows. And it does not perhaps grow exactly as it might grow in the body, but certainly you're watching human cancer grow, multiply, and become larger. And controlling the variables allows scientists to be able to introduce something that they're hoping will interfere with the growth or the propagation of this cancer in order to be able to draw a conclusion about the potential value of whatever it is that they introduce. And so that's bench research in vitro, meaning in glass. Now, whether it's a test tube, whether it's a petri dish, etc. Now, there are also animal studies. These are called in vivo studies. And what this does is to give an approximation of a disease state in an animal where it might be dangerous or impossible or impractical to do the study in a human being themselves. And in a preliminary state, certainly, we work with animals. So you may have, for example, a naked mouse, which is a kind of mouse that has been bred so that it does not have fur, and you can see the skin. And in this type of mouse, very often it is common practice for a researcher to take a small amount of human disease, colon cancer, for example, and inject it under the skin of the host mouse, and then to watch that cancer grow, not in a petri dish, but this time in a living animal, where there may be an immune system, where there may be other factors that are very much similar to what we're looking at in the final analysis, which is human disease. And these animals can then receive treatments, whether it's going to be something that is injected into the tumor or whether it's going to be something that is fed by mouth. These are ways of intervening to be able to see what may happen when you introduce something that has a presumed effect, and then be able to quantitate and look more closely at, one, whether the effect occurs, and secondly, what does that effect mean? Where do we go to look next? So these preliminary preclinical studies are extremely important in coming to conclusions about whether things have great interest for scientists or whether they don't. Now, let's be very frank about why scientists are looking at things like natural products. The vast majority, 30 years ago when I started to become interested in medicine and I was in medical school, the vast majority of the drugs that existed were drugs that had been copied from nature. They were synthetic versions, if you will, of natural elements that had been isolated from plants and animals that were found to have utility in the use of treatment of disease in humans. And so those elements were then potentiated very often by adding side chains to the molecule and with other methods of manipulation. And they still were modeled upon nature, but they were no longer natural. They were drugs. The body treated them differently than it would have treated something from the world of plants or animals that may have been taken into the body as food. It treated it very differently, but they were hopeful that it was going to make a difference. And certainly in many cases, drugs are an ideal way to treat certain diseases. But they always have the downside of unintended consequences, unintended effects known as side effects. So when these researchers started to look at the Mangosteen publications from 1980 up until April 2013, which was the cutoff date for their study, even though the study appeared only recently, this is what they saw. And you can see yourself that if you tried to quantitate, and it may be difficult, you look at 1980 to 1989, almost a decade, and really relatively small amounts of research for the mangosteen and xanthones. Another decade, 1990 to 1999. Once again, probably a doubling of what existed before, but certainly not a great deal of information. And then you come to 2000 and 2004. And here we have a doubling again of what was there in the previous decade, and it happens that the doubling time this time is 4 years. So obviously something happened between 2000 and 2004 that started to make scientists more interested in the mangosteen than before. Now, while I can't say absolutely what that was, to me it was the introduction of the mangosteen in the form of a botanical drink that was allowing people who had never been exposed to this plant before, never had xanthones in their bodies before, to begin to supplement with these new elements and to have an experience that they could recount. And look what happens. From 2005 to 2008, just 3 short years, look at the increase in the number of papers, really far more than a doubling. And once again, the only thing that I can see that was happening is that the mangosteen was now available in a supplemental beverage, specifically the one that I'm referring to, the Zango product, and it was being propagated as a potential supplement for people in a number of countries. So not simply in North America, not simply in Mexico, not simply back in other parts of Asia or Europe, but in a large number of countries, people were being able to use this. They were having results that they recounted as anecdotal experiences, and it was having an impact on what doctors saw with disease. And the doctors and the scientists, in observation of this, became curious. And when I first started to talk about the mangosteen, gosh, it was almost 14 years ago. My partner and I traveled to a number of universities, some of them in America, because that was the easiest place for us to get to. And we went trying to say to people, hey, look, we found something that we really think is interesting. Why don't you look at it as a scientist? And literally we got laughed out of a number of places, and it was highly embarrassing. We therefore went to the third world, and we started talking to people who had already been studying the mangosteen. And what we were doing back then, because the internet was certainly not the connectivity tool that it is today, we were putting researchers in Malaysia, for example, in touch with researchers in Japan, with researchers in Australia, with researchers in Thailand, so that they could network and that there would be some cohesiveness and trends that could be seen in the research that was taking place into the mangosteen and the mangosteen xanthones. Well, it wasn't long before the internet became the commonplace for people to go and connect with regard to scientific research. And so look what's happened to the volume of the research into the mangosteen and its xanthones between 2009 and 2013, about 480 papers, and just an absolutely snowballing increase in the number of researchers who are interested in the mangosteen. Next slide, please, Sandy, if you wouldn't mind. Remember that when David and I, my partner and I, started to go around the world, we were going to just 3 or 4 countries. But at the present time, when you take a look at the mangosteen research, you can detect that there are university professors in 19 different countries who are now researching the mangosteen. And in general, it's not a single paper. It is an interest that they develop when they try to prove a hypothesis, because that's what researchers do. And by the way, let me remind you that every time a research paper appears, it costs thousands and thousands and thousands of dollars to produce a research paper. It takes hundreds of man-hours, and when you look at the author line in most of these papers, you don't see a single name. On average, you'll see 4 professors. Now, these professors may be PhDs, they may be MDs, but nonetheless, these are learned people who are spending their time, hundreds of hours on each one of these research, if not thousands of hours, because it isn't just a week or 2 weeks. Most of these research papers are elaborated over months, so that a university with a continuing research interest may produce 4 to 5 papers a year, but are continually studying the mangosteen. And so we see this research, we see the expenditure of thousands and thousands of dollars in 19 different countries, and we see this snowballing. Now, if you were to look into the background of some of the other natural products, which have been called superfruits, but which in my opinion are not, something like the acai berry, you'll find quite a bit of traditional medical information about it. You will find that when it came on the market, there was a flurry of interest from academics, but it very rapidly petered away. And you won't see any drugs developed from that. The same is true of the aloe vera, for example, which certainly has applications as a natural product and has been built into many commercial elements that people purchased to look after burns, to look after the GI tract, etc. But after 60 years of commercial availability, we don't see this ascending movement of increase of number of studies because it hasn't turned out to be anything that has led to the development of a drug. And therefore, the interest of the academics who are trying to find a drug, because that's how professors, researchers, and universities make their money, is if they can find something that can be made into a drug that is going to be able to bring money to them, to their university, and prolong their ability to be able to research. They don't want to research flash-in-the-pan phenomenon. And so when you look at these things that come on the scene in the natural products area and then are very popular for a very short period of time and then dwindle away, you do not see sustained interest by the academics in those particular products. Now, we're going to look at some of the actual research in a recent review paper, and I want you to understand that when I start presenting this to you, because when you start to look at this slide and read the small print, you're going to say, what the hell? Well, I hope you don't say what the hell. I mean, you might say, oh my gosh. But I want to draw a parallel to an experience that I had recently. I fly a great deal in my job, and so I'm constantly in airplanes. And some of these airplanes are absolutely monstrous. The Boeing 747, for example, is an extremely imposing aircraft when you go in through the door and when you go in and find out that, my goodness, there's a stairway here and you can actually go upstairs and sit there in a first-class situation, and you can go down and you look and it's like being in a flying movie theater. There are as many people in there as there are in many movie theaters. And you sit down, strap yourself in, there's a lot of noise, movement, etc. And then finally you're up flying. And you don't really think too much about it unless you're crossing an ocean, and then you begin to wonder, how long can this thing stay up here? How did it get up, and is it going to get down safely? These are not uncommon questions for people to ask. But the fact is that virtually everyone who gets into one of these monsters is impressed. They are impressed. Well, I had a friend, and he worked at an airport. And he said to me, do you want to see something out of an interesting experience? And I had some time. We were planning to be together anyway. So we drove out to his place of work, and there was a Boeing 747 which was overnighting in the airport. And he got me onto the tarmac, and I was able to walk around on the ground looking up at this thing which went stories into the air, and had enormous wings that I don't know how long it took me to walk from one side to the other. I did it. It was a very great distance from one wing tip to the other. And he pointed out various things about the aircraft that he knew. But what I want to say to you is this. I'm not a pilot. I had no appreciation of the science of flight, really, beyond the most rudimentary concepts. I certainly didn't understand anything about avionics. I couldn't have told you even the beginning of what the electrical makeup of this monster was, but I was there underneath, standing by tires which were twice my height, and many of them, and looking at the areas that he was pointing out and listening to me as he said, you know, this wingtip can move through a 15-foot span when it's under load. Those were things that made me say, oh my goodness, I was in awe of what I was seeing. Now, that is what I want you to take from what I'm going to show you tonight, because I'm going to lay out for you, if you will, in a review paper, the data that talks about the research in the Mangosteen since 1980 and alludes to the fact that there is a snowballing effect. That means that there will be far more research in the future. If you noted on that last slide, or 2 slides ago, I said that there were now more than 60 xanthones found in the Mangosteen. Well, when I started out 12 years ago to look at this plant, there were only 40 xanthones that had been identified. As the years have gone by, as more researchers have looked at it in different phases of growth, et cetera, looked at it in greater depth, more than 65 of these xanthones have been identified. Every one of them is a potent antioxidant. Every one of them looks structurally extremely interesting. But you know, there's only been about 5 that have had any research into them at all, and one of them has overwhelmingly got probably more than half of the research, and that's a single xanthone called alpha-mangosteen. Now, there are dozens of other xanthones. There is nothing to say that the dozens of others which have not yet been investigated will be any less interesting than alpha-mangosteen. But there is a phenomenon about scientific inquiry, which is that when someone finds something interesting in one area, everybody goes to where the interest is. If there's smoke, there's got to be some fire there. So everybody rushes over, and they tend to look at the circumference of what has been found, and someplace on that circumference is a reasonable question to be asked, and they then start to ask questions, pose hypotheses based on what has already been found, and they research again. So I'm saying to you that the mangosteen xanthones, only about 5 of them have been investigated. There are over 65 of them, and the likelihood that there will be multiple times the interest shown in those new xanthones, as we have seen in the current xanthones, is really quite remarkable. But look at the things we're going to look at here, and we're only going to be talking about 3 of the 5 xanthones, really, that have been looked at. Now, this first paper is a table of the chemical properties and the biological activities of the mangosteen xanthones. And I'm not asking you to try and understand everything that's here, but there are things that will make your eyes open, will cause you to say, oh, when you look at the breadth of the things that have been studied by scientists, primarily in vitro, nothing that we can say will allow us to make claims about disease or even to talk about this as a treatment for a disease state. That kind of research does not exist. But this is billions of dollars worth of research, certainly crossing a great breadth of subject matter when you look at it. For example, enzyme modulation. Well, the whole body is modulated, looked after by enzymes. These are proteins which are involved in the chemical reactivity of all the metabolism in the body. Anti-tumor activity, antimicrobial. Antimicrobial means antiviral, antifungal, antibacterial. It talks about central nervous depressive activity. It talks about central nervous stimulant activity. It talks about neurological disorders, anticonvulsants, analgesic, meaning pain relief, antiarrhythmic, antihypertensive, anti-inflammatory. And then you can jump down to any one of the others and look anti-HIV, cytotoxic. When you talk about something that's cytotoxic, you're talking about something that will kill cancer cells or will initiate a process whereby the cancer cell destroys itself, regains, if you wish, a control that has been lost and that has caused it to become cancer. Aromatase inhibitory activity. This would be of value in breast cancer for women because the drugs that we use to chemotherapeutically prevent the recurrence of cancer in ladies with breast cancer of a certain type are aromatase inhibitors. When you look at the drop in testosterone in males as they age, aromatase inhibitors are sometimes used to be able to make a difference there. And so look at all of these things. Anti-inflammatory, perhaps half of everything that's been written is about the anti-inflammatory characteristics of these xanthones. Anti-ulcerative activities. And we'll go on to the next slide, Sandy, if you will, please. This is a continuation of, this is the beginning, rather, of another table. And this particular table is going to be talking about that category of research, which I mentioned to you earlier, is called in vitro research. And in vitro research, once again to remind you, is looking at things which are taking place inside test tubes, inside petri dishes, where there is an environment that's very controlled. Oh, Okay, somebody just gave me a comment here right on my screen. But this is the things that I talked about that compose the majority of the studies, these 480 studies that are out there. And they're very, very important. Now, as you look at this and you try to understand what's a human macrophage-like cell, what's a primary adipocyte, stand and look at that as if you were looking at a big tire and say, oh, that's got to be important. The scientists are looking at it. I know what that means. When you look at the tested compound, then you understand that what I was telling you is that alpha-mangosteen and something called gamma-mangosteen are the only two things really very much that have been studied. There's a couple of others, as I mentioned to you. But then you go out and you look at the outcome. And the outcomes are impressive to a scientist. Now, they should be impressive to you just because of the volume of the jargon. Now, you don't need to know what interleukin-6 is. You don't need to know what tumor necrosis factor alpha is. You don't need to know what PGE2 is or what JNK is. But I know, and the scientists know, and these people are spending thousands of dollars because all of these things have to do with the perpetuation of a chronic, steady inflammatory state, which is the reason why we have so many of the deadly diseases like diabetes and cancer and heart disease in our populations today as major killers. Next slide, please. What we're going to see here is a continuation of this same information. We're going to see more in vitro anti-inflammatory effects because, as I mentioned to you, about half of all of the studies that are in vitro and the majority of studies that are in vivo, meaning with animals, have to do with anti-inflammatory effect. Now, once again, take a look at this chart. Do not get wrapped up in the idea of the details, but simply look over again to the right-hand side and look and say, holy mackerel, this is really important because it's voluminous. And it wouldn't have gotten to the point of publication if they hadn't found something interesting. Now, here's something very interesting. Just on PubMed, which is only one of the databases that we look at for the appearance of studies about the mangosteen and its xanthones, there are approximately 66 animal studies. Most of these are attempts to take a look at a disease state, either a chronic inflammation state or a cancerous state in an animal. We have strains of rats, for example, that have been bred to be obese and have been bred to be diabetic. And so we can look at those models and we can intervene with the animals that perpetuate those models and see what happens when you intervene. So that's in the, I'm jumping away from this screen, but I'm talking to you about the fact that in those in vivo 66 studies, there wasn't a single time that the researchers had to postulate some benefit, which is why they start a study, postulate some benefit, and then finish by apologizing in the latter part of the study by saying, goodness gracious, we just didn't see anything that we were looking for. That's why the scientists keep coming back, because the fire keeps burning, the smoke keeps going up. The results are almost inevitably positive. And when I look at those 66 animal studies, I don't know of a single one where the scientists had to say, what we were looking for didn't show up in any term at all. And we basically were wrong, because it doesn't happen. That's something that's very unusual, particularly with regard to the study of natural products, because so often when scientists take a look at ingredients in natural products, take a look trying to confirm potential pathways that might be able to elucidate some of the claims that the people who have used these things have made, they very often have to apologize and say, well, unfortunately, we couldn't find it. Now, very, very often, that is because of the way the study has been designed. But, nonetheless, it is something that you don't see with the mangosteen. And that's why I say this doggone thing is a superfruit. Next slide, please, if you wouldn't mind. Now, again, this next slide is only going to be asking you to look at the size of the tires. It's the same thing you've been looking at, but I'm only trying to impress you by saying, look, it just keeps going on. It just keeps going on. And here we have alpha-mangosteen, and this time we have a new one called Garcinome B, which has a few studies about it, not many, but again, remember, the vast majority of these mangosteen xanthones have never even yet been looked at. Never mind the catechins. The catechins in the mangosteen, even though they're the same catechins that are found in green tea, they haven't been studied in the mangosteen. They've been studied in the green tea. What is learned about green tea, therefore, is applicable to the mangosteen. That's why this doggone thing is a superfood. Next slide. Because now we're going to look at in vivo anti-inflammatory studies. So this means these are animal studies that are coming up that have been in these databases, and we're going to start seeing what the scientists have found when they have taken and produced, either through selective breeding, some animal that is going to have evidence of chronic inflammation, or they're going to actually put a cotton pellet, for example, underneath a toenail and produce paw edema so that they can then watch when they give some of the natural products, some of the xanthones to it and see what happens. Now, in one particular study, an old study, but a very interesting study, some Indian scientists did that with rabbits. And they produced edema in the rabbit foot. And then they thought, very interestingly, there's a lot of talk in Ayurveda about this mangosteen that we're looking at. Why don't we compare it to some of the most powerful anti-inflammatory drugs that we have and that we use in humans and in animals? And so they took what are called steroids, not small, unimportant steroids, but the same kind of steroid that we use to help with the swelling of a brain when someone has had a serious head trauma. And they compared that. They gave that to the rabbit with the swollen foot. And they gave the mangosteen extract to the rabbit with the swollen foot. And guess which performed better? Yeah, well, I'm not going to tell you. You read the story. It is striking what can happen sometimes when you are looking at natural products and you're simply giving the raw materials to the body and the body's doing the work. You don't have to sort of fashion a drug outside like a silver bullet that's going to go into the body and ideally work in only one single enzymatic reaction, because you can't really be that precise, which is why we have side effects. But when you give raw material, food-based products like this, because this is a fruit. Essentially, mangosteen juice is a fruit juice. Somebody has asked me many times, how is it dangerous? And I say, would you be afraid of a glass of orange juice? The answer, of course, is you're not. Well, don't be any more afraid of this. It's something that people have been eating, drinking for years. And so go ahead and try and see what happens in you, understanding that the mangosteen elements themselves are not going to bring about some kind of drug-like interaction in your body, because they aren't drugs. They are the building blocks that the body uses to address the challenges that it faces. And it was Hippocrates who said, very wisely, this is not what is most quoted from him, but he said, respect your body's ability to heal itself. So often in our modern, postmodern arrogance in a biomedical model, we as researchers and doctors actually think we know better than the body what needs to be done. Well, as someone who has practiced medicine for a long number of years and who now is a little bit on the sidelines, I still see patients in a charity clinic, but I no longer have a practice. And I'm certainly not on the cutting edge for everything, but very few people know more than I do about the mangosteen. Nonetheless, I have seen too often the evidence in undeniable form that lots of times the body knows better than the smartest scientist what it needs to make itself better. And so the whole supplement industry is based on the idea that maybe there just aren't enough of the right things available to the body to be able to do what they have to do. Next slide, if you would, please. Now, I think that in this next slide, I'm not sure whether it's a continuation of the animal studies or whether it's the human studies, the clinical studies to which I made reference earlier on. But once again, I want to point out that the kind of studies that the FDA or other regulatory organizations in Canada, for example, would insist, this is the human study slide, would exist in order for us to be able to talk about this as a treatment for whatever it may be. We don't do that. We simply say, try it, see what your body does with it. And in this case, there's only 3 published studies. Now, there is a 4th one that has taken place. It's in China. It's much easier to do a randomized, controlled, double-blind trial in China because the government simply says, okay, everybody in this municipality is going to eat this for this long, et cetera, et cetera. But in the rest of the world, it costs millions and millions of dollars, and in fact, there aren't many of them. But there is one here that is from the actual mangosteen product that I'm talking about, this Ango juice. And I don't know of any studies for any other mangosteen-based products. So really, it's in a very elite group here. Next slide, please. As I'm getting to the end of my presentation here, but I get excited when I read about this because it's been 10 years I've been watching this, more than 10 years. And it is exciting to see that things get better. And as the scientists learn more about this remarkable fruit, I'm absolutely convinced that they're just going to keep running after it and running after it and running after it. And why? Well, we're going to take a look in the slide after this one. But this is a slide that has reference to anti-cancer studies, okay? And when we're looking at the anti-cancer studies, I want you not to look at it and try and understand everything that's there, but there are things that you can understand. If, for example, you look in that left-hand column, which is gradually coming up, you're going to see things that you can understand. You're going to see, oh, look, there's a study about mammary adenocarcinoma, in other words, breast cancer. Oh, there's one about prostate cancer. What kind of prostate? Human prostate cancer. There's one about colorectal adenocarcinoma, colon cancer. Another one about colon cancer. Another one about colon cancer. Goodness gracious, another one about colon cancer. And you're going to look and see the outcomes over here. And these references, again, are in vitro. So we're looking at what happens to a group of cells growing in a dish. And you will see induction of apoptosis. That means that the cancer cells begin to self-destruct. Cell cycle arrest, stop growing. Suppression of cell viability and colony formation. In other words, they stop growing. Anti-proliferative activity, etc. Next slide, please, Sandy. Wow. I'm just going to take a drink here for a moment. And as this next slide comes up, once again, I ask you, don't focus on what you can't understand. You can see what the tested compound is if you wish. You can see that there is a thing, for example, in that last slide, where there was an extract of alpha mangosteen and gamma mangosteen, and we'll talk about that in a minute because that's become even more important in the study. But these are in vivo. This is where they've actually grown a tumor on an animal. And then they have taken, and we'll look at some of the things. So here we've got, again, breast cancer, malignant glioblastomas, a brain cancer, prostate cancer, colorectal cancer, and colon cancer, etc. And then you look at what they're looking at, and again, they're only looking at these 2 or 3 mangosteen, usually xanthones, usually alpha mangosteen or gamma mangosteen, but not a whole lot else. And sometimes they're sticking it under a needle, subcutaneous. Sometimes it's in diet. Sometimes they're actually injecting it into the tumor. But look what happens. You can see the outcomes. You don't need to be a doctor to understand that this is impressive. Suppression of tumor volume and lung metastases. Decreased growth of blood vessels into the tumor. Decreased tumor growth and metastatic expansion. Increased destruction. Inhibition of tumor growth by 50%, inhibition of tumor growth, reduced tumor mass by 50 to 70%. Next slide, please, Sandy. These are things that, like when I looked up at the size of the aileron on this plane, I didn't need to know anything except the most rudimentary thing about what an aileron did to realize that I was looking at probably the biggest ailerons in the whole world, and that this was a remarkable thing that it could go ahead and do that. Now, in this next slide, we're going to be looking at something which is a little bit different. This is a look at what is called cell talk. cells in the body talk to each other. They communicate and give information from one cell to the next cell, sometimes right beside each other, sometimes at the other end of the body. And they do it by chemical messengers. And when you see an arrow, you then don't need to worry about what all these terms are, but when you see an arrow going down, and we know that we're talking about cancer here, so when you see an arrow going down or when you see an arrow going up, it means that when it goes down, the significance is that in the cell type from chondrosarcoma, bone cancer, or in leukemia, prostate cancer, melanoma, skin cancer, malignant glioblastoma, brain cancer. Now, when you look at those cancer cell types and you look at what was studied in them, you're looking at things which either facilitate the growth of the cancer or they impede the growth of the cancer. And if they're facilitating the growth of the cancer, what you want to see to have a good outcome is a downward arrow. And if it's going to be something that is going to destroy the cancer and you want to see a good effect, you're going to be looking at an upward arrow. So all you need to look at in this left-hand column is, holy mackerel, there's a whole lot of things that are bad that are going down, and there's really quite a few good things that are going up as a result of the introduction into this cell growth mass of some of the xanthones from the mangosteen. Next slide, please. Cell-cell communication is extremely complex. These messenger molecules are so important in health and in disease that it's extremely important to understand that when you can influence them in the case of cancer, and this last slide talks again, and you'll see lung cancer, breast cancer, prostate cancer, etc., you're going to see that it's talking about what is called cell cycle arrest. So in other words, when a cancer cell, which turns over much more rapidly than a normal cell, is in its cell cycle and increasing its speed when you introduce the mangosteen into these cells, it looked like it slowed them down. Now, metastases. Most of us understand that if the majority of cancers stayed in the place where they first started in the body, unless it was something like the liver, we're not likely going to die from it, maybe the brain. But if you get cancer in your breast and it only stays in your breast and keeps growing there, you could live for years and years and years. The problem comes when the cancer, through complex mechanisms, the use of metal, I won't talk about the details because it wouldn't mean much to you anyway. But when there are appropriate circumstances, pieces of that cancer break off and they head to other parts of the body, other vascular beds, like the lung, like the liver, like the brain, like the bone, and they take and seed in those areas, and you get a secondary cancer which is from a distance, but now growing in a bone where it didn't start, growing in a lung where it didn't start, growing in a liver where it didn't start, for example. And that as these metastatic growths increase, then the individual succumbs to the cancer and dies. So metastatic spread of cancer, extremely important. Once again, take a look at these arrows. In this particular case, things that are promoters of metastases, all of them going down. Now, that's not to say that everything that has to do with metastases is looked at here, but some of them are, and the results all appear to be significant. How do we know that? Well, they're still looking at them. More scientists are studying it all the time. Next slide, please. And we're going to finish here because it's been quite a while. I think I'm probably longer than I'm supposed to have been. But I wanted to try and communicate to you that me as a doctor, somebody who loves to give things to people that don't hurt them, that may have an effect in making them better, I want to tell you that as I watch the Asians, the Americans, the researchers in the world, and the pharmacological companies in the world try and take elements from the mangosteen and develop them into drugs, I'm thrilled. This means that we really do have something striking. Now, aloe vera, for example, to go back to my comparison, very, very important, can do quite a few things, but nobody's interested in it enough to make a drug out of it. It's been around for 6 decades, no drugs. This thing has been around really in a commercial way for about 5 years in heavy concentration. And look what's happening. The Japanese have already marketed a crude drug. Now, they have a category of things called supplements, and then they have an intermediate category called crude drugs, and then they have formal pharmaceuticals. And there are criteria to be in both of those, in all of those different places. But they've taken panaxanthin, which is 85% alpha-mangosteen and 15% gamma-mangosteen. I don't know why it said 5. There are Thai companies that are marking 3 anti-acne preparations. Oh, this is because I corrected my copy, and I didn't correct Sandy's copy. Sorry, Sandy. So there are Thai companies marketing 3 anti-acne preparations with different actives in Asia. The xanthones have been synthesized by American Asian pharmaceutical interests. Why is that important? Well, remember, drugs are not natural. Natural products are not drugs, and drugs are not natural products. Drugs are very often an imitation of a natural product, a potentiation of a natural product, but more dangerous than natural products. Remember that. But in order to get close to a drug, if you're going to spend the thousands and millions of dollars that are necessary to get a drug, the very first step, besides finding out its utility, is you got to synthesize it. And so the fact that xanthones are now being synthesized by American and Asian pharmaceutical interests indicates that these guys already know the importance of this. They're going to make drugs out of it. It's no longer a question of if, it's only a question of when. And the Chinese interest in a recent study, which I've seen but which you haven't seen yet, have stated that they're actively developing synthetic xanthones as anti-cancer drugs. So what does this mean? It means that when you look at the multitude of supplements that are out there, when you can take your hard-earned bucks and you can purchase something from a supplement market that is a dog's breakfast at best, it's very hard to find some evidence that you should be spending your money here rather than spending your money there. One of the most important windsocks, if you wish, to say, look this way, is when there is increasing scientific interest in the natural product that you're contemplating taking. Because it means that very smart ladies and men are looking at this product and saying, wow, look what it does as a natural product. Wouldn't it be nice to have a drug? And that's about all I have to say about it, but I hope you can understand my enthusiasm. This is real. I've watched it now for a decade, not a small amount of time. If you'd seen what's happened to my body in a decade, you would realize that I've been around for a long time. I tried to thread a needle tonight. This is a guy who used to be able to tie surgical knots with one hand behind his back. I tried to thread a needle because a button fell off my shirt, and I thought this was something where I might be seen on the webinar. So I went and sewed my button. It took me 5 shots to get that stinky little piece of thread through the needle's eye. So has time passed since this has come to my attention? Absolutely. Am I more and more excited about it every day? Absolutely. Will it become greater than the aloe vera, better known, a household word? Absolutely. Thank you very much.